A Moralis, I'm the National Veterinary Manager in Zoetis, Ireland for the livestock portfolio, and I'm also currently the President of the North of Ireland Veterinary Association. I'm here to talk to you today about preventing disease in young calves. So just a bit of an agenda. The things I'd like to be looking at is what are the key diseases in young calves and in the first few weeks of life. And I'm sure you all know this from your own farms, enteric disease or scars in the first 0 to 4 weeks of life. However, after that, pneumonia becomes the biggest disease threat to our calves up to a year old. After that, the risk factors of disease, and Stephen has already alluded to this, management, virus, and calf factors. So it's really about keeping all these things in balance. And I think every single element of this will be covered, throughout today. So that should make my job a little bit easier. Then, vaccination, obviously I do work for a pharmaceutical company, but, at the end of the day, if you are spending the money on vaccine, you want a successful outcome. So how to make the most of your vaccine, and then a little bit around recognizing symptoms of disease and when to intervene as well. So I've already mentioned it, the key diseases in young calves. Overall, pneumonia was the biggest problem in calves aged 1 to 12 months of age. So what we're looking at here, and apologies, I know it is very, very small, but I've put it up there just to show it to you anyhow. What we're looking at is reports from the All-Island Disease Surveillance Report. So that is showing calf mortality both in the Republic of Ireland and in Northern Ireland at the laboratories DAFM and AVB. And what we can see on those is that the biggest cause for calves going to the lab or ending up dead in our laboratories from 0 to 4 weeks of age was in fact a scar in the first month of life. However, after that, 1 to 5 months of age, respiratory problems or pneumonia become more important than scars, more important than systemic infections. And then moving on to 6 to 12 months in both laboratories, respiratory infection again was the most common reason for calves ending up on the post-mortem table, more so than even Clostridial disease. So I think Stephen has alluded to this, what we're trying to achieve. We end up, we start with a 40-kilo calf being born, and what we're trying to achieve is a 350-kilo heifers at 13.5 to 14 months of age, ready for bulling. However, there's many challenges around the way, and Gillian has mentioned about challenges and stresses. Any stresses will have a negative impact. So if we look at the scenario of a spring-born calf, and we're looking at potential challenges, and there's probably many more out there that I haven't thought about. Things like this budding, for instance, can cause a stress. Weaning and mixing of dairy calves can cause another stress, and any of these stresses will make the calf more susceptible to disease, and diseases such as scar and pneumonia, which you do see very early in life. As you're turning the calves out, potentially, parasites could be a problem. So both gutworm and lungworm, of course, and lungworm is becoming more important this time of the year, when we're thinking about housing again. And obviously, it will weaken the capacity of calves to actually deal with any viral infections coming back into the house in the autumn. And again, that will make them more susceptible for pneumonia. So all these things will have an impact on their performance and on their ability to actually achieve that 350 kilogram target at 13.5 months of age. If we're thinking about the risk factors out there, so Stephen has sort of alluded to this. We're talking about nutrition, for instance, that will have an impact on calf factors. So if we look up here, nutrition, things like poor cholesterol intake. So if your calf is not receiving those 4 liters within 6 hours of life, what will happen is that they will be more susceptible to disease. Other nutritional factors such as low levels of vitamin E, low levels of selenium potentially will have an impact on the ability of the calf to cope with any disease out there. Any concurrent disease will make calves more susceptible to disease, and any of these factors will have an influence on whether the calf is likely to go down with a case of pneumonia. Things like naval ill, even scars could have an impact on that, and breeding conformation. And if you look at little calves like Belgian blue calves, which have very small lung capacity, a fairly short neck, potentially not a very long windpipe, these calves will be more susceptible to disease as well. The environment, Jamie will be talking about that, but ventilation, humidity, anything that will impact to housing will have an influence on stress on the calf, and any stress will have a negative impact on the calf's ability to cope with disease. And then we have the viruses, and I'm sure you're familiar with maybe all or some of these viruses. You've all heard of BVD. We're in an eradication program in Northern Ireland here at the moment. So what BVD does is it will make calves more susceptible to other viruses, such as pneumonia viruses called RSV, PI3 and IBR. Okay. Now, viruses are thought to be a primary cause of pneumonia, and secondary, we will then have bacterial infections. So the likes of your Pasteurella pneumonias, your mycoplasmas may come in as secondary pathogens, which will result in calves actually ultimately going down with disease, and unfortunately sometimes they can't be recovered. Obviously, remember, lungworm this time of the year will be important as well. So as I've said, pneumonia is caused by a mix of bacteria and viruses, and it is thought that the viruses are the primary insult. However, the bacteria, such as your Pasteurellas, are living in the back of the throat. So what happens if a calf is affected by a virus? You can see those little cells here. This is what we call ciliated epithelial cells. Now, if those are affected, they exist all the way down the windpipe and the bronchi. So if the calf has been affected by a virus, what happens is that those little cells actually become flat cells, which means they can't trap any of the dirt and the dust anymore. And basically any of the bacteria that are sitting in the back of the throat can just travel all the way down to the lungs and cause a case of secondary bacterial pneumonia. Just to show you a few types of pneumonia. So we have acute virus pneumonia, which for instance could be caused by RSV. Calves in their first winter will be at serious risk of RSV pneumonia, and obviously we can end up with these chronic poor doers as a result as well, or unfortunately dead calves. And then your secondary type of pneumonia caused by bacteria such as your Pasteurellas and your Mycoplasma bovis. So what are the risk factors in the house at the end of the day? Why is it that we end up with calves going down with specifically pneumonia more so in the house? Any events that are happening in the house, such as mixing of calves, housing, etc., will stress the animals. I've put up a picture of this budding here because I think that's a particular stressful event for a very young calf, especially if we don't use any pain relief, for instance. And any stress on a calf will increase cortisol levels, and as a result of that, we will have a reduced immune function. And then if we're in a housed environment and there's not as good a ventilation, what happens is we end up with meeting all the pneumonia viruses, RSV, PI3 and IBR. And as a result of that, these calves can go down with disease. Now, this actually is a good example of a house that is working well. However, many houses don't have as good a ventilation. At pasture, the risk factors are completely different. Obviously, there's plenty of fresh air out there, so but however, the animals are grazing, so therefore lungworm will be a bigger risk at pasture. So when we're talking about pneumonia control, or even control of any disease, it's all about balancing the risk in between challenge and immunity. And if you think about challenges that may occur, for instance, mixing of animals, mixing them with older stock, potentially a poor environment where you have, a fairly challenging environment, potentially a draft on a calf could cause challenges. So any reason why the animal may be stressed will increase the challenge, and therefore increase your chances of an animal going down with disease. On the other hand, if we can give good nutrition, plenty of good quality colostrum, plenty of good quality feed, after that we have a good healthy environment, we can reduce stresses, then we go down the point of immunity and we end up with a healthy calf. Now, what does vaccination do for you? Vaccine will actually help you get that balance right, okay? But I think we need to all be realistic. If we still have a very high challenge, we may not get the effect we would, the desired effect or the desired outcome from vaccination. So it's really important that we realize that vaccination is helping us increase that immunity. However, we also need to reduce the challenges to get the balance in the right place. So what are the key viruses in young calves? So when I was working in Northern Ireland, I did a little bit of investigation. So we looked at, over a 2-year period, we looked at a few hundred calves on a number of farms. And what we looked at was we blood sampled calves over 4 months of age. And we looked at, these calves had all had maybe a case of pneumonia. And we looked at which viruses did they show a positive antibody response for. And what you can see here, and sorry if you can't see it at the back, but basically you can see here that the first 2 columns are the highest, and that is showing the results for RSV and PI3. IBR, which you can see here, and BVD were less important in those very young calves under 4 months of age. So the key disease risk in calves under 4 months of age, and that will be no different, anywhere else in the UK or even in the Republic of Ireland, are the most commonly associated viruses with disease. So as said previously, it's all about increasing the immunity in the animals, reducing the amount of infectious agent, and also keeping the environment healthy. And obviously think about nutrition as well, and that's what increases immunity within the animal. So how to get the best from vaccination? I'm sure many of you are using vaccines in many shapes and forms, and I think, at the end of the day, if you are spending that money, ideally, you'd like to get the absolute most out of it to end up with a positive result. So first of all is vaccinate fully before the risk period. So we're now in the autumn, or we're coming towards the autumn, which means that you may be housing some animals in on the 1st of October, let's say. If you are using an injectable vaccine, for instance, prior to housing to cover your animals for pneumonia, and this vaccine requires a 2-course dose 3 to 4 weeks apart and a second shot 2 weeks later, then ideally you'd need to start more or less now to make sure that you have full onset of immunity prior to housing, okay? So generally with injectable vaccines, it could take, 2 to 3 weeks after the second shot before you get full onset of immunity. Then we have intranasal vaccines or live vaccines, which quite often are given up the nose. And these vaccines will give a much quicker onset of immunity. So if you're thinking about your very young calf, for instance, obviously the risk is there all the time, there's quite high disease pressure because you've constantly got new calves coming in there. You're maybe, as I said, disbudding, or then you're mixing them, etc., etc. So you want a very quick onset of immunity in those young calves. And that's where live intranasal vaccines come in and have a good place. You want to vaccinate all calves in the population at risk and persevere. So I'll go into a bit more detail on that in a minute. But it is important to understand that if we vaccinate calves, we don't only reduce clinical signs or clinical signs of disease, or we don't only increase their ability to cope with disease. However, we also reduce the challenge. So that vaccine, because once we have less diseased animals, obviously we have less virus in the environment, and the animals are less at risk, or more likely to remain healthy. Use vaccines properly, and again, I will go into a bit more detail around that in a minute. But Gillian has already mentioned about reading the data sheet. This was in relation to a SCAR vaccine, but I have seen farmers using intranasal vaccines into the muscle, for instance, and unfortunately it didn't work. Avoid vaccinating during periods of stress. So for instance, if you want to use an intranasal vaccine in a very young calf for pneumonia, you maybe don't want to do it at the same time as disbudding or at the same time as weaning or moving it, because if the animal is stressed, it will be less likely to put up an immune response. And then remember, vaccines are an aid to control, and they just really help you keep that balance right in between challenge and immunity. So assessing the pneumonia risk. So I've already talked about RSV and PI3 being the key viruses in those very young calves. What happens is if calves get plenty of good quality colostrum, obviously what we want is them to get plenty of maternally derived antibodies. Now, that is great. However, when it comes to vaccination, that can be a challenge. So ideally, in those very young calves, not to 12 weeks of age, that have quite a high amount of maternally derived antibodies, if we're talking about a pneumonia vaccination, we would recommend to use a local intranasal vaccine rather than an injectable vaccine, so it doesn't interfere with those maternally derived antibodies. Once a calf comes up to 12 weeks of age and it starts building up its own immunity, and it becomes more susceptible to other viruses, RSV, PI3, BVD and IBR, injectable vaccines are a good option. So I've already talked about vaccinating all the animals in the population at risk and persevere. And some of you in challenging times might think, right, well, I'm going to vaccinate all my heifer calves, but realistically, I don't really want to spend 5 or 6 or 7 quid, whatever, on a bull calf, which I can totally understand. However, if you do that, you will compromise the health of your heifer calves as well. So just having a wee look at this here. So we're looking at two populations of animals. The top ones here are non-vaccinated animals, and then we have the bottom ones here, which are vaccinated animals. So you can see in the top chart that we have a very large proportion of susceptible animals. These are unvaccinated animals, and some animals may have already gone through disease or might have been vaccinated, so therefore they could be immune or healthy. However, what happens if a virus, for instance, comes into this situation? The virus has a great ability to travel across a population, and you will end up with a high level of disease, okay, which will increase the challenge within the environment, the challenge of viruses, and even immune animals could go down with disease. Now, if you vaccinate that same group of animals, what happens is that suddenly you have a much lower number of susceptible animals, and you have a much higher level of immune animals, and the chance of having a massive outbreak of disease is going to be reduced massively. So I talked a little bit about, make sure you've administer vaccines correctly. 3 routes commonly. We have intranasal vaccines, we have intramuscular vaccines, we have subcutaneous vaccines, and I would recommend you to read the data sheet as to what needs to be done, and please, talk to your vet if you're unsure, because this is crucial. And unfortunately, I have seen situations where intranasal vaccines were put into the muscle, and the farmer had spent the money, but was still suffering the consequences of disease. Handling vaccines on farm, if you're using any type of equipment, hygiene is going to be crucial. Make sure that your syringes and your needles are clean. You don't want any abscesses as a result of it. And also, if you're using any automatic injection equipment, just make sure it's calibrated correctly and that you are giving the full dose of the vaccine. We go through, as a pharmaceutical company, a great amount of effort to keep vaccines within required temperatures, from 2 to 8 degrees Celsius. Just make sure that when you are using vaccines, that you are giving them as quickly as possible. So, for instance, with live vaccines, you want to make sure that they are given within 2 hours of mixing, and just make sure that they keep cool up to the moment of injection to avoid deterioration of the live antigens. And then what about sick animals? So generally we would recommend not to be vaccinating sick animals. So if you could maybe keep them away from the rest of your animals. And I also, however, there might be one maybe caveat to that. If you're talking about IBR and you have animals at immediate risk of IBR, I would say talk to your vet, because you may consider vaccinating them. So I talked about making sure that you get full onset of immunity prior to the challenge. And for instance, if you're looking at an injectable vaccine and you need to give it 2 doses, and you need to have a protective immunity above the level of the red line here, it will be important that you have those 2 doses given well in advance to actually get that immunity. Sometimes farmers ask me, is it okay to just give them the 1 shot? Will that help? Well, it might help a little bit. However, you need to be realistic and think, that the duration of immunity won't last at all. So vaccine storage, I've alluded to this already. This was a study done in England where they looked at 19 farms, and unfortunately they monitored the temperatures of the vaccines every 30 minutes. And what they saw was that on these 19 farms, there was none of them actually stayed at in between 2 and 8 degrees Celsius for the entire duration of the monitoring period, which was about for about 6 months. So you need to be realistic that live vaccines will be probably deteriorate if they're not at that required temperature. Inactivated vaccines, if they are frozen, they won't be working at all either. So this is what good looks like. If you don't have a fancy fridge like this here with a temperature gauge, you could invest another 20 quid after the colostrometer and buy one of those minimum maximum thermometers and stick it into your fridge and just make sure that it stays at the required temperature. So just to say, yes, we talked about the viruses and the ability to vaccinate against those viruses. We know that RSV and PI3 are the most common viruses in those very young calves. There luckily is a vaccine available for those. However, we need to be aware that there aren't vaccines out there for every single pathogen. So if you look at the bacterial pathogens, so other the likes of Mannheimia, for instance, for Pasteurella multocida, for instance, there isn't a vaccine available there. Mycoplasma bovis, again, we don't have a commercial vaccine available there either. And that leads us to potentially the reason why sometimes things don't go well. It may be that the farmer has incorrectly administered the vaccine, so incorrect route or death of a live vaccine, especially if it wasn't kept at the right temperature, or it could be the correct administration and the animal could respond. However, the vaccine was given too late. Okay, the animal was already infected. So just make sure that full onset of immunity, or potentially the wrong strain or organism could be another reason. Remember, we can't vaccinate against all the pathogens, or the animals could be immunocompromised. So if the animals are stressed and you vaccinate at the same time, you won't get the best result either. Now, once it comes to disease, calves, if you compare a cow with a horse, for instance, you can see from this picture here that cows have much smaller lung capacities. So if a calf is infected early on in life, this will, this can very quickly lead to chronic cases. And as a result of that, we will have continuous impact on productivity. And cattle are very good at masking the signs of disease. So it's difficult to know sometimes, when should I actually treat this animal? It's important that we treat those animals on time. However, you don't want to be treating every single animal in the herd either, just in case. I mean, at the end of the day, we live in a world where, antimicrobials become a much more valuable and resource, and we need to be considering that aspect for it as well. So I'm going to end with this chart here, and I was pleased to see that actually it appears in the booklet as well. So this is what we call the Wisconsin scoring chart, and I think it's, again, we talked about protocols here earlier on. You mightn't be managing your calves yourself, or you could have various people managing calves on farm, and it's making that decision as to when should I treat that calf. So this is making things quite easy, because there's only 3 things you need to be looking at. You need to look at their ears, their eyes, and their nose. So that's the first thing you do in first instance. And then every single one of those can give you a score. So for instance, if you have a cloudy discharge out of one nostril, a little bit of eye discharge, and a bit of a droopy ear, you have a score of 3. Now, right, what does that mean? Do I need to treat this calf or not? Well, you could see, right, is that calf coughing? Well, yeah, when I move it around, actually, it is coughing. So that's a score of 2. So now I have a score of 5, which means actually now I need to treat this calf, because if I have a score of 5 or more, I need to go out and treat it. If you're still unsure, you can go and take its temperature. And then again, depending on the temperature. So if it's a normal range in between 100 and 100.9, that's a 0. However, anything over that will give you a score as well. So there's no need to go out with a thermometer right away. You can just look at those 3 factors and see, is it coughing? If the score is 5 or more, you need to go out and treat it. If it's 4, you can just keep a good eye on the calf. So just want to finish with this. Just to summarize, we know that scar and pneumonia are key diseases in young calves. Scar will affect them in the first 4 weeks of life in general, whereas pneumonia will affect them for the rest of the first year of life. Pneumonia is a multifactorial problem. Think about the calf, the environment, the viruses out there. It's important we balance the risk of disease for successful prevention. And remember, vaccines are there. They are an aid to control, but you must maintain that balance. And if you are deciding to treat, it's important that you have early detection. And I would encourage you to either look at your little books there for advice, or else download the Wisconsin scoring chart. So thank you for